more than 2,800 new cases of COVID-19 confirmed across the state. According to the Alabama Department of Public Health, we've now surpassed 305,000 total cases. Almost 250,000 of those are confirmed. Since yesterday, we added 62 more COVID-related deaths. The total now just over 3,700. Total presumed recoveries nearing 184,000. Now, health officials offering more detailed expectations and guidelines for the COVID-19 vaccine. So far, 6% of Alabamians have contracted the coronavirus. That's 300,000 people who have built up antibodies to the virus. Health officials say that group should give others a shot at the vaccine first. State Health Officer Dr. Scott Harris says most data shows people cannot get reinfected sooner than 3 months.
All things being equal, we'd give it to everybody whether you've had it or not, but because there's not enough to go around, we're going to say you can wait if you've been infected in the last 90 days.
The Alabama Medical Board of Examiners will offer temporary emergency licenses to qualified physicians. This due to a shortage of critical care doctors in the state. Doctors must meet certain criteria. The temporary license will expire 180 days after its effective date or when Governor Ivey lifts the state of emergency. More than 100 nursing students and staff are joining other healthcare workers on the front lines at UAB to help with the battle against COVID-19. UAB is currently short on nurses due to the spread of the virus and because of the intensive care the disease requires for each patient. The nurses and students will help provide bedside care as well as assist with distribution of the vaccine.
I think as a nurse, it means, or a soon-to-be nurse, it means everything, that we can come out and help, our fellow nurses and everybody else in the hospital to do what we can and do our part, whatever that may be, just being able to help out in the hospital.
UAB is currently short, faculty and students received training last week and this week to refresh the skills they need to have to care for a patient with COVID-19.
Hospitalization is taking a slight downturn today across the state. The patients being treated in hospitals for COVID-19 down to 2,310, 32 fewer cases than yesterday. Over the last 2 weeks, hospitalizations have broken daily records, like at UAB, where they're treating 171 inpatients for the virus. That's the highest reported. And tonight, DCH is treating 159 patients. The need for emergency room visits hasn't stopped during the pandemic, but there is hesitancy about actually going to the ER when emergency care is needed. WVTM 13's Chip Scarborough explains why it can be a bad idea to avoid the emergency room.
UAB Hospital is dealing with two major tasks right now, treating an increasing number of COVID-19 patients while also vaccinating frontline healthcare workers. But through it all, there's one thing the hospital wants to make clear.
UAB is still here to care for patients, particularly those having emergency conditions.
Despite hospitals being filled with COVID patients needing critical care, they say you shouldn't put off emergency care over fear of coming to the hospital.
It's still safe to come see us for treatment. The emergency departments are open.
Hospitals like UAB have already had to scale back on non-emergency and elective procedures. But despite the fatigue that many doctors are facing right now, they're determined to keep treating those most in need.
We're always going to be here to care for you, and we hope that we're not put in a position in the coming weeks to have to curtail services further, because we want to be available for you when you need us.
Doctors are pleading for help controlling the spread so they can keep caring for those most in need.
Treat everyone you know as if they have COVID-19. Wear your mask, socially distance, wash your hands, and be careful.
Warning hospital conditions will keep worsening if these simple steps aren't followed. In Birmingham, Chip Scarborough, WVTM 13.
COVID-19 testing is getting easier and more convenient. The FDA approved use of this over-the-counter at-home test. Many doctors in our area have expressed a need for more testing options. The new at-home test provides a result in roughly 20 minutes. But Dr. Karen Landers cautions it's a rapid test and not a PCR.
Persons that are asymptomatic and have no known exposure to COVID, if they have a positive test, they really need to check with their healthcare provider about any potential follow-up of this.
Dr. Landers also worries about people actually reporting their positive test results to their local health department. Once the new tests are made available, they'll cost around $30. People can then connect to a digital app to help with understanding the results. After a difficult school year, employees in Coleman City Schools are getting a boost just in time for the holidays. Every full-time employee will get a $500 bonus. The school board approved the one-time payment as a reward for the additional work required to successfully maintain services during this unprecedented time. This will be paid no later than December 21st. The money is from the CARES Act. And sad news tonight, another Birmingham restaurant closing its doors. Today, Fancy's on 5th announced New Year's Eve will be its last day. The owners say while this may or may not be permanent, they'll be closed for 3 to 4 months. They say COVID-19 really took a toll on the restaurant. They have dates listed on their Facebook page. Get the latest on the COVID-19 pandemic with the WVTM 13 app. It's free to download from the Apple and Android app stores. See updates on stimulus efforts and much more under the coronavirus tab in the main menu.